The purpose of this DVD is to teach you basic counseling skills that will help you in your work of providing support to your patients. It's necessary for you to understand what your patient may be going through and how to best help him or her.
Counseling is an interaction between two people that involves a conversation directed at specific goals or outcomes. Often the goal of counseling with a patient who is troubled in some way is to help reduce his or her distress. The counselor guides the patient in identifying the main problems that will be the focus of the discussion. Both the counselor and the patient have specific roles to play. The counselor's overall objective is to help the patient address some of the challenges she faces. The counselor's role is to listen attentively to the patient's concerns and respond empathically in a helpful manner. Counselors do not provide financial, material, or practical support. For example, a counselor would not lend the patient money, provide childcare, or confront family members on behalf of the patient.
Let's turn to the role of the patient. The patient is expected to be willing to share his or her concerns with the counselor. This means that the patient has to come to the counseling session prepared to talk about the problems he or she is dealing with at the moment.
The counseling environment is a safe space in which to discuss and address the problems in the patient's life, with a view to finding a way forward. The counseling session should be conducted in a private room with no one else present. This will ensure that the counseling conversation will be kept confidential. Confidentiality means that no one besides the counselor and the patient will know what has been discussed.
There are special characteristics that are very important for a counselor to have. Counselors should be as non-judgmental as possible, which means they should make a serious effort not to judge or evaluate a patient on his or her behavior. The counselor is there to provide emotional support to the patient, which can only be obtained when the patient feels completely comfortable. In order to be non-judgmental, the counselor needs to be aware of his or her own assumptions, values, and biases in order to ensure that these don't negatively influence his or her interactions with the patient. Counselors need to be empathic, which means they try to see the world from the point of view of the patient, almost as if they're walking in his or her shoes. An empathic approach allows the counselor to understand how the patient's life circumstances influence his or her behavior.